All right, well, I want to share some tools and techniques for helping to treat and resolve chronic neuroplastic pain. I know these tools and techniques work because I've used them myself over a number of years to heal and recover from neuroplastic pain. And I'm really excited to, share some of the tools and strategies that I used in the form of a user journey map. So I'm using this idea of a user journey map because as pain sufferers, we're on a journey and we're using tools and strategies to help recover from that. What I've got here is I've mapped out some of the tools that I used, some of the major milestones along the way, and some of the barriers that actually get in the way of effective pain management. So if we think about who this strategy is for me, it's for people suffering pain greater than a 3 out of 10. So it's bothersome. It gets in the way of life. People who are beyond the initial kind of shock, denial, anger of having a pain diagnosis and ready to put some steps into place to hopefully recover from or reduce their neuroplastic symptoms. I guess where we're headed, if we kind of fast forward a little bit, the ultimate goal here is to get pain to a level of 2 out of 10 or less and identify yourself as being functionally recovered. So saying, look, pain doesn't bother me anymore. This pain management is automatic and it happens without me having to think. Personally, I was really fortunate enough to recover from chronic pain and captured my learnings in a book. So I've kind of captured this framework in my book called Past Pain. What I'm doing now is sharing the journey that I went on. So we've got the ultimate goal in mind, but back at the start, I guess there's a number of milestones that we achieve on our pain management journey. So if we have a look at the center section, the main goal, or the main milestone rather, is setting a goal. So I know for a number of years personally, I didn't have a goal really. I couldn't articulate anything. But actually setting a goal and saying, well, look, my pain is at level 6 out of 10. I want to get it to 2 or 3 out of 10 or less. And that's our North Star. That's what guides a lot of the strategies that we want to implement. The next biggest milestone is having awareness of why we're experiencing pain. Now, I know it's kind of obvious because, hey, I'm in pain, but it can take a little while to understand why we're in pain. The main tool that we can use to do that is writing. So writing down our thoughts, our feelings, being aware of when we're in pain is really powerful for knowing why it occurs. And if we know why pain occurs, we can then put strategies in place to help reduce it. The main, tool that we be using time and time again in pain management is somatic tracking. So some people may have heard of this as mindfulness or pain reprocessing therapy, but essentially it's like a targeted meditation that allows us to check in with the pain symptoms and feelings to help process and hopefully rob them of their power and resolve that. Like anything, it takes practice. Milestone 4 is seeing it work. Some people, can have quite good progress in a matter of weeks, but as in my case, it took many months of dedicated practice, and even feeling that minor reduction in pain was an incredibly rewarding milestone. And then finally, along our journey, a big goal is doing that physical movement that would have caused us pain. So doing that hobby, doing that sport, doing that lifting, bending, twisting without pain, and that's a major indicator that we're on the right track. Of course, with any milestones, there's obstacles, barriers, and problems. So these things are perfectly normal. Really, they're things that we expect in pain management. Unfortunately, we can't avoid them all, but we can design interventions or design ways to help reduce the amount of time we're kind of stuck on a barrier. So a number of, thought processes and points that helped me was largely around breaking down this big goal into smaller steps. So, okay, going from a pain of 6 out of 10 to 2 out of 10 is really scary. So breaking it down into the smallest step imaginable and getting quick wins is a really easy way to overcome that obstacle. Probably the big one here is, man, there's lots of scary moments in pain management. And the number one is that uncomfortable moment of actually sitting with our pain and experiencing it. I think because we're so used to fleeing from it and kind of putting it off and pushing it away, actually sitting and experiencing and processing it can be a really uncomfortable thing, a really scary thing, even though it's quite safe. I guess scary activities lead to procrastination, and procrastination leads to being overwhelmed with podcasts and books and YouTube tutorials and videos and Facebook groups. Look, all things that can be really helpful for affecting our recovery, but often it can lead to procrastination. So for me, having the permission to park all those adjacent activities is a really good way of overcoming some of those obstacles. Another obstacle is carving out the right time to do the practice. So the key to I guess treating and resolving neuroplastic pain is somatic tracking. So is checking in with our pain sensations and allowing them to kind of essentially fade away over time, and that takes time. So yeah, unless we're willing or able to carve out 5, 10, 15 minutes a day, really unlikely we're going to see some significant progress. I think achieving these milestones takes three big changes. So one is the mindset change. So the different thoughts we might kind of bring to pain management. The others is the different behaviors. So what actions or steps do we practically have to take to make this happen? And then the third thing is the time commitment. So we've had the mindset change. We know the behavior we're supposed to do. How are we going to carve out time to make this happen? I think when it comes to these mindset changes, the big one, and it can feel really counterintuitive, the biggest mindset change is that pain sensations are good as long as we understand why they've been triggered and we can implement some sort of meditation to help reduce the feeling of pain. I think it's important to bring a lot of curiosity, empathy, compassion with ourselves. Because, hey, pain management is a skill and it's a marathon, not a sprint. And there's going to be lots of ups and downs. We might fail at first, but the important thing is to keep trying and committing a few minutes each day to continuing to level up. Yeah, I think probably, I guess one of the more interesting things that for me, a lot of pain management material didn't cover was these rewarding moments along the journey. So when I was recovering from pain, there's a lot of really intrinsically rewarding moments that make me happy and bring a lot of, I guess, enjoyment to the process. I think when it comes to starting this process, it's really hard to show up. It's really hard to put the practice in place, especially on a down day. We've had a bad day, a big pain flare up. We don't feel like kind of doing pain management, but it's rewarding to even carve out a few minutes for a practice, even on a day that's quite challenging otherwise. I think another rewarding moment is that light bulb moment when you think, I know why I'm in pain. I know this thought or feeling or movement that's actually triggered these emotions that have really exacerbated the pain signals that I'm feeling. That's really empowering, and it feels like that. I'm in control now, and it feels like it is a real change and improvement. I think there's also a lot of other rewarding moments when you can start doing hobbies again or pick up other sports, things that you had to stop during pain. And that's really interesting because often that's when other people notice your journey. And I guess seeing kind of like the comments and the positive feedback from other people that don't really know that you're on this journey, I think that's a super encouraging part of the pain management process. Wonderful. So that is a whirlwind overview of how I was able to implement writing and somatic tracking to help reduce and ultimately overcome my chronic pain. As I mentioned before, a lot of obstacles, a lot of barriers. This is challenging, but the barriers are kind of like common. That they do happen to a lot of people, and there are steps that we can put in place to overcome. And it's often the intrinsically rewarding moments that, I guess, fuel and allow us to continue on this pain management journey. Wonderful. All right. So I think that's pretty much it. I hope you found it. Useful. I hope that this enables you to set a goal, to break it down into smaller steps, and start practicing pain management techniques. Look, if you would like some more guidance on this, as I mentioned before, I did capture my learnings in a book called Past Pain, available online. There is a link in the description down there. Other than that, I wish you all the best on your pain journey.